Hi, everyone. Welcome to the Becoming Anchored podcast. My name is Laura Deneen. I am one of your hosts today. I'm super excited for today's episode and the wisdom from the lovely Hannah Wise. If you are new to the show, we are about two things on this podcast. So, first and foremost, we talk about some of the pain and suffering that we have been through in our personal lives. We are here to just talk about the human experience and the different things that we go through as human beings and some of the hardships that life brings. And secondly, we talk about some of the pieces of wisdom that we have gleaned over the years as therapists. Lauren and I both just cherish this work. We adore sitting with clients. It is so life-giving. It's so meaningful to us. And we're here just to talk about both of those things together. So you'll hear some pieces and bits of our personal lives, and you will also hear some of the therapeutic wisdom that we have learned over the years. Quick disclaimer, this is not meant to be your therapy. If you are in the state of Tennessee, Hannah and I both see clients at Anchored Counseling Company in Brentwood, Tennessee, and we would be so honored to see you. And if you're not in the state of Tennessee, we encourage you to reach out to someone local to you. So without further ado, I want to introduce you all to Hannah Wise. She is a wonderful intern at our practice here at Anchored Counseling. Welcome, Hannah.
Hi, Laura. I'm so excited. Thank you for having me.
Of course, of course. When I emailed the team a few weeks ago and asked who wanted to be on the podcast, Hannah was actually the first person that emailed me back. And that is one of the things that I love the most about Hannah is just her eagerness to jump in and learn and try something new. And yeah, I just cherish that quality about you, Hannah.
Oh my gosh, thank you. Yeah, I feel like I have a lot to learn. There's so much ahead of me still, so I'm just trying to take advantage of every opportunity to do that. And also, I was excited to talk about some things I've been in that same boat, been learning about. So, yeah.
Yeah, absolutely. So today we are going to be talking about unpacking rumination and what to do about it. So if you have been in therapy before, perhaps your therapist has used this word rumination. It's kind of some fancy clinical jargon. So we are here to talk about what it is. And we also want you all to have practical takeaways for how to begin tackling rumination, because rumination can lead to a lot of pain and suffering. So Hannah, I would love to hear your take on how you explain rumination to your clients.
Totally. So, I like to think of rumination as being synonymous with analytical thinking or anxiety, or really any term that works for you, fits within your vocabulary of what it means to have kind of a sticky brain. Essentially meaning thoughts enter our brain all the time. A lot of times they don't have much value or meaning. Our brain's just constantly generating content. With somebody who tends to ruminate, their brain attaches or is sticky towards pretty much any thought that enters their brain, and their brain feels the need to analyze it, to unpack it, to get curious about it, to try to figure out if it means something. And that can cause, depending on how much you engage with it, a lot of impairment in your life because it takes you out of the present moment. It makes it really hard to connect with other people because we're living in our heads, is essentially what rumination is and how it operates.
Yeah, yeah. And I love this term that you use, sticky brain. I use that a lot with my clients and definitely resonate with that terminology based on my own lived experiences. And just a quick side note, you all, Hannah really loves working with clients presenting with anxiety and OCD. And so she has
Mhm.
really just blossomed in this specialty here at Anchored and is really doing a lot of ongoing learning and training around this topic. And so that's why we chose to talk about this today. But yeah, I think that's the sticky brain, number one, stood out to me in what you shared. And then number two, yeah, the reason that clients come to therapy for rumination is because it takes them away from their lives and it causes significant pain and suffering. Another way to think about it is like, I'm in my head all day, or I like can't stop thinking this thought, or yeah, it's like the meaning that we're making of the thought itself that becomes highly distressing to our clients.
Right, absolutely. And I want to emphasize that everybody ruminates to a degree, right? And that's because we care about things in our lives. And a lot of times, anxiety is actually a adaptive kind of symptom or emotion we experience because it keeps us safe. It gets to the point of rumination and impairment when you are spending the vast majority of your day every day ruminating, which happens in cases of OCD. So if that is what a client is presenting to me, instead of trying to immediately make behavioral changes, I would much rather focus on their rumination and trying to help them heal through that first, because it tends to make the behavioral changes much easier. And we could talk more about what I mean by like something more behavioral versus rumination, which would be more of like a mental compulsion or a mental behavior.
Yeah, I mean, I'm hearing you say like an internal versus external kind of dynamic that's showing up. Is that accurate?
Yes, exactly.
Yeah. What do you find people ruminate on?
Oh my gosh. Well, it totally depends. Everybody ruminates on things a little bit that are a little bit different. Sometimes people can ruminate on things that are, regarding important life decisions that they have to make coming soon, or people can ruminate on whether or not they should eat a particular thing for breakfast, right? It can be things that are maybe a little bit more deeply connected to our values and our interests, or it can be, like I said earlier, just the random content that our brain is constantly generating, and the sticky brain just kind of will grasp onto anything that enters into our awareness.
Yeah. Yeah. Can you give me an example of just a common, maybe thought or sticky thought that might become a rumination that maybe you've heard of in your clinical experience, and we can kind of walk through that together on the show today?
Yeah, I think that's a great idea. Let's see, a common thing that people worry about. One thing could be, am I a bad person? That comes up a lot. Just this question of, or they do something or they interact with somebody in a certain way that brings this thought of, am I a bad person? And there's a few
Mm,
ways. So the first thing would be someone would mentally ruminate about that question, and the compulsion, the more, but or the external behavior could be a wide range of things depending on the person. But yeah, I think that'd be a great example to walk through.
yeah. So am I a bad person? Whew. That's a heavy question. And I could see that if someone has that thought and also has a sticky brain and doesn't necessarily have the therapeutic skills or intervention yet to work with that thought
Yeah.
and to practice some of the skills that we are consistently teaching our clients, that would feel very distressing
Yeah.
if you are latching onto that thought. Like, am I a bad person? I mean, that's character, that's reputation, that's our
Mm-hmm.
integrity.
Right.
I hear a lot of shame in that question
Totally.
as you raised it. So I do think that this is a helpful example for us to walk through. So yeah, what if a client comes in and they're like asking you maybe after a session or session 2 or 3 or whatever, and they're starting to kind of dabble in this question of like, am I a bad person? What do you do with that, Hannah?
Well, there's a lot of different ways that you can go. If somebody is maybe more on the anxiety side of the scale than OCD, I might lean more into where they might have learned that about themselves, or what does it mean to be a bad person, kind of doing something more exploratory like that. If it's that person, I notice tends to be maybe a little bit more OCD inclined. And what I mean by that is, if I think someone's maybe leaning more towards OCD versus anxiety, they tend to be a little bit more hyper vigilant. Their rumination takes up more time than someone who's necessarily just anxious. But if someone's more OCD, I would maybe explore like, does that thought feel like it grips you and pulls you in and you can't quite get out? I would maybe try to have a better understanding of how much time and energy that thought requires. And if they feel like they have to figure it out, they have to come to some sort of answer, but also usually they can't quite ever, they never get to an answer that is satisfactory, so that thought keeps popping up over and over and over again, and they go through kind of the same like mental hamster wheel of analyzing it from every which angle.
Yeah, and I do think a couple points from what I heard you share just now. Number one, I do think that this is common in a lot of different types of compulsive behavior that we
Mhm.
see with OCD. It is never enough, in air quotations. If you're watching on YouTube, your
Yeah.
brain will say like, okay, if I do this one thing, then it'll be enough. But the kind of end line is always moving if someone has
Yep.
OCD.
Yep.
And so that is a marker, and that is, I think, a trait of untreated OCD, or even individuals that have been diagnosed with OCD is kind of feeling this restless energy of like never enoughness.
Totally.
Yeah, yeah. And Hannah has talked a little bit about this on the show today, but there are a lot of similarities between generalized anxiety disorder and obsessive compulsive disorder. And there are differences as well. And so, what I heard you say, if someone comes in and they're like, am I a bad person, Hannah? You are first going to assess, okay, what is the appropriate diagnosis for
Totally.
this person, which I think is like really good clinical discernment. We want to know what the diagnosis is so that we can have the appropriate treatment plan. And
Yeah.
now there are a lot of similarities there, but I do think it's really important to have that diagnosis so that we as therapists are giving the best care to our clients.
Yeah, totally. And you can think of anxiety and OCD as almost like a Venn diagram. They have similarities between them and similar presenting like symptomology, but also there are differences and both in the presentation, the experience that the client is having, and also I think you just kind of tapped on this, the treatment. Someone with anxiety, my more therapeutic style would be to lean more into things such as cognitive behavioral therapy and dialectical behavior therapy, where if someone is presenting more with OCD, I would dive into, yes, some DBT and CBT, but more so exposure and response prevention or ERP, where we are in the ways that I'm currently being trained, we would first teach the client how to stop ruminating, and then we would start to do exposure work around that, both in the presence of a trigger or something that would tend to make the client ruminate. And then, so both in the presence of a trigger and then without the presence of a trigger, just so they can continually practice that skill. And the exposure is meant to not get the client to experience a bunch of anxiety like in more traditional ERP work, but to actually have them be as less anxious as possible when they encounter the trigger, so they can actually learn like, hey, I don't have to feel so anxiety ridden and awful when I encounter this. Like, I can be okay and move through it.
Yeah. And so the fancy clinical terminology that we use for that is the process of what we call habituation. And so we on the show, I think that knowledge is power. And so we definitely, as therapists, I'm all about providing psychoeducation. It's how I train my team here at Anchored,
Mm-hmm.
because we don't want to withhold information from clients. And
Totally.
so here on the show, we will certainly provide information on some of the more clinical terms that we use in our work. But yeah, Hannah is just referencing habituation, where we become hopefully less anxious over time with the same stimuli. So circling back to the am I a bad person,
Yeah.
and someone presents this way and you identify, okay, there most likely is some rumination going on here. One of the things that I think is really hard for clients is even this almost like epiphany that I see in my office of like, are you telling me that there's another way? So there's two things that come up, or maybe even more than two things. But first, it's like, oh wow, this is actually a thing that I do that is treatable. And yeah, there's almost this disbelief of like, oh, I can actually work on this, especially for clients that are maybe older in their 30s, 40s, 50s, 60s,
Yeah.
that have been ruminating for the entirety of their lives and they don't necessarily know that there's a
Absolutely.
different way of doing things. I think there's also a grief that comes up with that, right? If someone has never had treatment for their anxiety or for their OCD, there is a grief of like, oh wow, I've spent a lot of time and I've even lost a lot of time to my rumination. So those are the two primary responses. So that, oh wow, I can actually possibly stop ruminating. And then I also see the grief in my office quite frequently as well.
Yeah, absolutely. And that is kind of the complexity of therapy, right? There tends to be a lot of emotions that we hold at one time, even if they are opposing. So there's elements of relief, there's elements of grief. And also, what I really try to promote in my clients, especially as I'm trying to teach them how to stop ruminating, is the sense of autonomy. You don't have to be. You don't have to let your brain be in control of you. You can take some more power back within your own brain, because these clients feel such a sense of powerlessness with rumination, especially when you tend to be more on the OCD side, because these are things they've felt like their whole life they had to do in order to stay safe. And so I'm trying to reestablish the sense of agency and autonomy in their lives of, you don't need to do this to feel safe. there are other ways and you have some choice. And a lot of times when people don't have choice or feel like they don't have choice, they're trapped. And opening up options for them can be really liberating in the sense that they have some agency again.
Yeah. And I think it cultivates hope,
Yeah,
right? So we have
absolutely.
our tagline anchored in hope that we have on some products. So definitely look those up if you are on the Becoming Anchored Co site. But yeah, it cultivates hope. And that is our job, especially like throughout treatment, right? But if someone comes to us and they're in sessions like 1 through 5, they might be experiencing hopelessness around their symptomology. And so I do love what you just shared for that reason, because I really do think it instills and cultivates hope in our clients, and people want to feel better at the
Mm-hmm.
end of the day.
Mm-hmm.
Yeah. So if someone comes and they're asking, am I a bad person? What are the first few steps that you were working on with them?
Absolutely. So let's just go with this. This is an OCD client. So if they're having that question, am I a bad person? I would want to, number one, do some assessment around how often does that question come in? How much time do you spend ruminating on that question? Do you ever feel satisfied in being able to figure that out? That's what I would start with is I just want to get a better understanding of what purpose this rumination serves. Then we might do something called discovering the core fear. The core fear is an emotion that the client is worried about experiencing forever. It's usually tied to some earlier childhood experiences or is just shaped and developed by experiences they've had throughout their life. And that also helps like kind of bring some consolidation of the rumination or more like external compulsions that the client is doing because they can feel really random sometimes. Like, for example, I recently was chatting with a client and she told me that she would check the toilet to make sure she flushed before she left the bathroom. She would do that multiple times. She had no idea why she was doing this. And as we worked through the core fear, we actually it feels crazy. We discovered, along with some of her other compulsions and things she would avoid, is that it was attached to this like feeling of inadequacy and inferiority. So, by working through that core fear, it gives the client an understanding of what's going on. And then from there, I would try to teach them how to stop ruminating. And we can talk more about what that means. But those are the three things I would do initially is like, where does this come from? Trying to do some assessment around it, figuring out the core fear, and then teaching the client how to stop ruminating.
Yeah, that's great. Yeah, and examples of core fears. Jenna talked about this. We had Jenna Overball on the podcast a few weeks ago, and she talked about like a lot of core fears being tied to like, I can't handle it.
Yep.
I think other therapeutic modalities would also label these as like negative core beliefs. So in EMDR, we do a lot of work around the NCs, so negative core beliefs, but I can't handle this. I'm unworthy. I'm unlovable. I'm a failure.
Mm-hmm.
Whatever the core fear is, like Hannah was talking about, it is shaped typically by some of our childhood and developmental experiences. So I do think having that information, both for the treatment plan and for the client, can be really validating for
Yeah.
their experiences.
Yeah.
And it
True.
sounds like you've certainly done that with your clients. So if we move towards the, okay, what's next? So what are your favorite practical skills to give to your clients that might be ruminating?
Oh, great question. And I feel like in therapy or in psychology or mental health, we say all the time, like, it depends. And it does. It depends on the client because at the end of the day, everybody's a little bit different and we want to do what works best for them. But what I primarily start doing is I want the client to understand and practice the difference between awareness, attention, and engagement. And I can quickly describe what I mean by that. So, things in our awareness are things that we don't have control over. Like I can see it out of the corner of my eye. Like I have some flowers on my desk. I'm not really paying attention to them, but they're in my visual awareness. I can see it. Just like thoughts enter our awareness all the time, most of the time they just float right by. We don't really do anything with it. They enter our awareness. And then we have something called attention. Attention is something we have much more control over, unlike awareness. Attention is where we are directing our focus. So, like I said earlier, even though these flowers are in the corner of my eye, I'm not directing my attention to them. I'm not looking at them. I'm not thinking about them. I'm directing my attention to our conversation that we're having right now. And that's something that I am enacting control over. The last thing is engagement, which can be synonymous with rumination. And that is when we are being wrapped up and absorbed by the thing we are directing our attention to the point that it's pulling us away from everything else. So this would be analytical thinking. This would be trying to figure something out. That is engagement. Also something we have control over. So I teach the client with those three things and teach them about how rumination is them engaging with their thoughts or directing attention moving into engagement. Yes. And I try to teach them or have them practice how to let thoughts that might typically like hook them and pull them into rumination, how to let those things just exist in their awareness. It's okay. It can be there. We don't have to push it away. We don't have to make more space for it, but we also don't have to like follow it down the rabbit hole that it might want to pull us into.
Yeah, absolutely. Hannah's so wonderful at describing things. We had a team meeting the other day and we were talking about a couple different things and people were raising their hands and we were like, okay, what are we doing with this and this and this? And Hannah was like, okay, so what I'm hearing y'all say is this, and this. And we were like, exactly. And so, yeah, that's just like a little sidebar. I really appreciated that in that moment and certainly appreciate your thoughts on those three levels of thinking. And I think that even imparting that information and providing that psychoeducation to clients can be really helpful. So if a client is asking, am I a bad person? What this might look like in engagement. I mean, one thing came to mind for me, and I'd love to hear some examples from you as well, but maybe the client like mentally reviews all the times that they believe that they've done something bad or that other people have thought, that they're a bad person, whatever that means to them. And they can spend like minutes or hours of the day doing that. So looking at the evidence that this thought might be true, that might be an example of someone really being in like the engagement stage. Any other like examples coming up for you?
Yeah, that was a great example. So like, oh, I forgot to hold the door for this person as I was entering the building today. That must mean I'm a bad person. And then trying to think of other examples. And I think also you just illustrated something important that often shows up with rumination of like this catastrophization or all or nothing thinking.
Yeah.
When you think about something like in a more holistic or balanced way, not holding the door open for someone doesn't automatically mean you're a bad person, but somebody who ruminates would tend to go down that path. So I think that was a really great example and describes like trying to figure out if it's true. Another thing might be like, does this mean something? Does this have value? Like, okay, well, if this is true, then that means that I am not worthy of being a good friend, or I am not worthy of having a partner. That might be other examples of rumination or the rabbit holes you can go down is like trying to extract meaning from this thought that really is essentially meaningless and just a piece of content that your brain generated.
Yeah, and I completely agree with that statement. And it's interesting because I think this is true in my own story. And my husband has actually pointed this out in a loving, kind way to me.
Mhm.
But we as humans are quick to forget maybe the other times when we open the door for someone. And so that's another thing about the like anxious brain is that yes, you might not have opened the door for someone. Does that mean that you're a bad person? I would argue no. Now, I also wouldn't want to give the client reassurance
Sure.
around that. But we tend to also forget, like, what about all the other kind things that I have done throughout the day? Maybe I picked up a coffee for my colleague, or maybe I texted a friend that was in pain, or maybe I delivered a meal to a new mom who just had a baby. Like all these things that we've done that really are like rooted in kindness. And in that moment of pain and suffering in rumination, I think a lot of our clients tend to forget all of the wonderful things about them or the
Yeah.
wonderful things that they've done. And so it's just a little side note that came to mind as you were talking.
Yeah, and I think you're totally right. And that's also like something I really enjoy about my or just therapeutic practice in general is like I'm not a purist. I like to be eclectic. So like that what you just described is like trying to introduce some flexible thinking to the client, which is maybe more
Right.
of a dialectical behavior therapy skill,
Right.
right? That doesn't mean we don't have space for those types of interventions with clients who are maybe their main presenting concern is OCD. There's other value that we can extract from other modalities and you don't have to be a purist ERP therapist to be successful with OCD. And I would actually probably argue that you'd be more successful by bringing in components of other therapies, because sometimes ERP fails to look at like the deeper context and
Yeah,
lacks some of the relational pieces that I think are really important to therapy.
absolutely. Absolutely. So if we circle back to the engagement piece, right? And
Mm-hmm.
this client is in engagement and we've identified that therapeutically, where do you go from there?
First, I would point that out to them and see
Hmm.
if they notice that. Like, hey, I noticed that you are ruminating in the room with me right now. Did you notice that? Depending on how much time or time we've spent learning about rumination and practicing how to stop, they may say no, they may say yes. So that's the first thing, is just bringing awareness. And that's what I give as homework for the first few weeks, usually when I'm working with somebody, is I just want you to try and notice if you're ruminating, because usually before they came to my office, not always, but a lot of the times, clients didn't even recognize that they were engaging in this mental behavior. And so it can take a lot of reps of just recognizing that it's happening before we can really get good at being able to stop. So that's the first thing I would
Yeah.
do. And then I would, depending on how regulated the client is in the moment, potentially engage in like an exposure opportunity right there with them of trying to stop or inhibit themselves, or I guess, what's the word I'm looking for? Just relinquish the rumination and maybe take a step backward into just attention. I'm just focusing on it. I'm noticing this thought is there. And then taking another step back into awareness of, this is in my peripheral vision, but I'm not necessarily focusing on this right now or trying to figure it out. And I'm not trying to force my attention away from it. That's also important. It's just naturally letting my attention float wherever it may land.
Yeah, yeah. And so what you're really referencing is what we call in the therapeutic space non-engagement strategies, right?
Mm-hmm.
So this is the like, I don't have to figure this out right now. I don't know. Maybe, maybe not. These are ways that we interrupt some of the ruminative behaviors in a loving, kind way, of
Yeah.
course, but in a way that's also not avoidance, right? Of like, just stop thinking that.
Right.
Thought stopping is, this is not what we're talking about, right? We're not talking about
Totally.
stopping the initial thought. We're talking about how we respond to the painful thought when it shows up. And those
Yeah.
are very distinct differences.
Yeah, if you can think about holding the thought in your hand, rumination would be tightly, tightly gripping this thought so hard. Thought stopping would be with this gripped hand, throwing the thought away as far away as possible. Disengagement would be just opening your hand and letting the thought float out of your grasp naturally.
Yeah. Yeah. Well, and I think it's holding it more lightly, right?
Yeah.
Like I've been talking to a lot of clients just about like surrender and what is actually in our control versus what isn't. And yeah, I do think that there's a rigidity that comes with rumination and holding on to things tightly, whether someone has
Mm,
anxiety, OCD, or some other presenting concern. And so I do think this is valuable for a lot of us.
yeah.
Um,
And not and rumination, right? Like, I think I maybe mentioned this earlier. Like, anxiety a lot of times is a survival mechanism. If we didn't have anxiety, we wouldn't feel pressed to go to work and pay our bills, right? Like, there is value with anxiety and stress. And so my goal is never to take that away from somebody, which I think is related to why thought stopping is actually not useful. My goal is to make you aware of how your brain's operating and maybe being able to shift it in a way that isn't causing impairment in your life. Because rumination at one point for the client was serving them well. It felt like it was keeping them safe. But they show up in our offices because it's not working for them anymore. And it's causing a lot more impairment than it is feelings of safety.
yeah, absolutely. Anything else that you would add to this like question of am I a bad person? I know there's a lot of other skills
Mm.
that we haven't even talked about today, but anything else that feels pressing?
I think I think we've really hit the majority of where I would go if a client presented to me of, am I a bad person? The only other thing I would maybe say that we haven't discussed is like validating that that is an okay thought to have. That's
Mm,
not bad that you had that thought, but let's it analyze why that thought's coming to you and how it's causing you pain.
yeah,
Not
yeah.
not saying that this thought is bad, but does it have to be true? And do we have to try to extract meaning from it? Do we have to figure it out, which may be prolonging your pain? Once we can kind of let those defenses drift away, we can actually dive into rebuilding self esteem, rebuilding autonomy, and hopefully shifting to kind of bring back what you said earlier around core beliefs, trying to shift core belief in another direction that's a little bit more like positive and uplifting and gives the person confidence to be who they are.
Yeah. Yeah, absolutely. There's a lot of compassion in what you're saying. And yeah, I think sometimes clients get stuck in the content of their thoughts, and therapists can as well. And
Yeah,
I think there is room here for like validation of the painful experience of having that thought.
totally.
Right? We don't have to provide all this reassurance of like, no, you're not a bad person, you're not a bad person, you're not a bad person, because as we talked about earlier on the show, that satiation will continue to be there. That's not necessarily an effective treatment intervention.
Yeah.
But where I might go with a client is like first and foremost just validating, wow, like that seems really painful that you're experiencing that thought, and I'm here to like honor that pain and
Mhm.
support you in figuring out how we can move forward so
Yeah.
that you're not suffering anymore. But yeah, I mean, I think there's absolutely an appropriate place to validate that thought, like, am I a bad person, is very painful.
Yeah, and asking your therapist, "Am I a bad person?" That might be a compulsion. So it's important to,
Yeah,
as therapists, to look out for that because providing that reassurance seeking is going to bring that client, yeah, some temporary relief, but it's not going to result in long-term healing.
absolutely. Yeah. Gosh, you are just a wealth of wisdom. Thank you, Hannah.
Oh, thank you so much for having me, especially as a baby therapist. But it's been really great to talk about some of the things I'm excited to learn about and work on with clients. So thank you.
Yeah, of course. Hannah has just done phenomenal work both as an intern with Anchored and with your clients. And I just cannot speak highly enough of her and the person she is and the therapist that she is. So I'm super grateful for her time with us. So we always close with an affirmation
Mhm.
and some homework. So we focus here at Anchored on like asking the client like what they're planning to work on outside a session or what they would like to take with them. And so Hannah, would you like to provide one or both of those items today?
Yeah, I think an affirmation that comes to mind for me is especially as you I think what you said earlier about working with people in their 30s, 40s, 50s, 60s who may have been ruminating their whole life and there's some grief. I would say like you're never too old and it's never too late. It's never too late to come to therapy. It's never too late to start your healing journey. So if you can have the bravery and the courage, which everybody can, it's not too late for you. You have a lot of life left to live. So that would be
Yeah,
my
absolutely.
affirmation.
I love it. I love it. And what about any homework you would give to our listeners today?
Any homework I would give to our listeners is pausing and noticing rumination and if it's coming up in your life, right? Like, even if that means you don't do it until you're going to bed at night and you just pause and try to reflect back on your day of were there moments that I was really caught up in my head? And a great way to catch it is like, was there a time when I was at work with my friends and I totally wasn't present? Like, I don't even remember what I was doing because I was really wrapped up in my own brain. That would be my homework, is maybe some taking a couple minutes to reflect on where maybe rumination is showing up in your life.
I love it. I love it. Well, what would you like to highlight and how can our listeners find you?
Yeah, so listeners can find me at Anchored. My profile is on the website at Anchored Counseling Company. Definitely come see me. I'm taking clients right now. Yeah, that's my main point of contact, or my email is hannah at anchoredcounselingco.com if people want to chat more or have questions.
Awesome. Well, thank you so much for your time today. We are super grateful. And thank you to our listeners for listening in for this episode. And we hope it was helpful to you all. And we will see you next time. Take care, guys.